Hello and welcome dear student. Today I will talking about the obesity. This lecture is presented by Dr.ZUHAIR. In this lecture I will talking about the definition of obesity, body mass index BMI, causes of obesity, metabolic changes in obesity. First, I will start with the introduction about the obesity. Worldwide, obesity has nearly tripled since 1975. In 2016, more than 1.6 million adults aged about 18 years and elder were overweight. Of these, over 650 million were obese. Over 340 million children and adolescents aged between 5 to 19 years were overweight or obese in 2016. 38 million children under the age of 5 years were overweight or obese in 2019. Obesity is the very novel. So, what is the obesity? Obesity is a disorder of body weight characterized by an accumulation of excess fat in the body or excess body fat. Body mass index also can be calculated by the formula which equal weight in kilogram divided by the height in centimeter. So, what is the normal body mass index? For normal person, body mass index is average between the weight and height in centimeter, but normally is standard about 19.5 to 24.9 kilogram per meter. Also, the person classified as overweight if the body mass index of 25 to 30 gram per meter. And obese is also classified as when the body mass index is more than 30 kilogram per millimeter. So here, this is the definition of World Health Organization WHO. Obesity and overweight are defined as an accumulation of excess body fat to an extent that may be impair health. That by mean also the obesity is the abnormal accumulation of fat in excess, which this accumulation of fat can maybe impair health by several ways. An accurate population measure of excess fat is the body mass index BMI. A person's weight in kilogram divided by the square of his or her height in meters. WHO defines overweight as a body mass index of 25 or more, and obesity as the body mass index of 30 or more. In this picture, show us where the fat or high amount or excess fat stored in the body. In the large amount of visceral fat, here increase of the weight or around the hip of the person. This is the site of excess fat can be accumulated. This in this picture, which also similar like the apple in shape of the upper body obesity. In female, a small amount of visceral fats, just in hip, more accumulation of fat in female rather than waist in male. The female here by accumulated the fat at the hip, which resemble like the pear shape at the lowering of the body obesity. In this picture also show the very huge body mass index and also these are classified as obese. So 35 genes: environment, obesity, hyperglycemia, hyperinsulinoma, insulin resistant, type 2 diabetes. That by mean one increase in body mass index, which reads the obesity more than 30 kilograms, 30 body mass index kilogram per meter. The obesity may also lead to hyperglycemia or other disorders related to obesity and excess fat, which cause insulin resistance, and this also can lead finally to diabetes mellitus type 2. A high body mass index is a major risk factor for a number of chronic diseases, including cardiovascular disease, cancer, and diabetes. Obesity is a condition in which the natural energy reserve stored in the fatty tissue of humans and other mammals is increased to point where it is associated with certain health conditions or increased mortality. Although obesity is an individual clinical condition, it is an increasingly viewed as serious and growing public health problem. So body fat is necessary for storing energy, heat, insulation, shock absorption, and other function. By meaning, also the fats play major role in the body energy, isolation, shock absorbance, and other functions. So fats have a function for the body, but when this fats be excess can lead to other chronic disease. The normal amount of body fat expressed as percentage of body fat is between 25 to 30% in women and 18 to 23% in men. Women with over 300% body fat and men with over 25% body fat are considered obese. Obesity is not just a cosmetic consideration. It is a dire health dilemma, directly harmful to one's health. That by mean the obesity is not just for the look of the men or women, which they are style and body, not like this cosmetic consideration, but the obesity and excess fat may lead to health problems, and so it is harmful rather than should be in cosmetic shape. Insulin resistant type 2, adult onset of diabetes, hypertension, high cholesterol, stroke, vascular accident, or CVA, heart attack, congestive heart failure, cancer, gallstone, gout, osteoarthritis, sleep, ischemia, Becowin syndrome, when the obesity, red face, underventilation, and drownness. So these also are conditions or disease or risk factors caused by the hyper of body mass index, which also known as the obesity. And there is a big quick man syndrome, which characterized by the obesity and red face, underventilation, but by mean slow ventilation, and drownness. So causes. What is the causes of the obesity? The balance between calorie intake and energy expenditure determine a person's weight. Overeating and physical inactivity can lead to obesity. Genetic overeating A diet high in simple carbohydrate, frequency of eating, slow metabolism, physical inactivity, medication, psychological factors, disease such as hypothyroidism, insulin resistance, polycystic ovary syndrome, and Cushing syndrome. All of these are the causes or can lead to over body mass index and obesity. Childhood weight. A person weight during childhood, teenage years, and early adulthood may also influence the development of adult obesity. Being mildly overweight in the early 20 years was linked to a substantial incidence of obesity by the age 35. Being overweight during elder childhood is highly predictive of adult obesity, especially if a parent is also obese. Being overweight during teenage years is even a greater predictor of adult obesity. Hormones. Women tend to gain weight, especially during certain events such as pregnancy, menopause, and in some cases with the use of oral contraceptives. Biochemistry of nutrition and exercise. The three primary factors influencing metabolic homeostasis are genetic, inheritance, nutrition, and exercise. Maintaining a healthy weight significantly by lowering the risk of type 2 diabetes and cardiovascular disease. Energy balance refers to the metabolic state in which the calories contained in the metabolic fuel you consume are equal to the calories you expend. As a result of chemical reaction in the body, muscle contraction, and thrombogenesis. Here in this picture show us the body mass index and energy balance between intake and expense of this calorie. So we have to put the role in to get body mass index by calorie intake and balance to calories expend. And this also done by regulate the feeding or eating and do exercise or regular exercise to maintain the body health and not obese. There is some hormones concerned to fatty tissues or adipose tissues which can produce it by it, such as leptin. And leptin is a peptide hormone that is secreted by physical adipose tissue, that by means surrounding the abdominal, in proportional to the amount of stored lipid. Since leptin inhibits appetite and increase energy expenditure, it may represent a molecular regulation of fat. So, following a period of positive energy balance, fats store increase, which result in elevated serum level of leptin and subsequent activation of neural signals that decrease appetite and increase energy expenditure. This return the body to the normal set point weight. So it is also the balance between the weight loss and weight gain. We have to make a good balance. In this picture show us the diagram of hypothalamus, which related to the stomach, release some of hormones such as gastrin by the stomach and pancreas, which release different type of hormones such as insulin. And here is the adipose tissue release leptin, and also all these are concerned about the fats in the body and regulation of the fat in the body. So metabolic changes is observed in obesity and metabolic syndrome X, by meaning in the metabolic changes by the ovary have a certain problems in metabolic disorders such as cholesterol or glucose intolerance, insulin resistance, hyperinsulinemia, dyslipidemia, hypertension, and lastly dyslipidemia. Recently, studies have suggested that some types of cancers may be also linked to obesity. Although there is no escaping in biochemical reality that energy balance determines body weight, not all foods of equal calories provided the same nutritional value, and therefore what you eat can be almost as important as how much you eat. Thank you very much. By end of this lecture about the obesity.